Hi, I'm Shauna Bradshaw, Dr. Mom HD, and welcome once again. Today we're going to talk about hand, foot, and mouth disease. So what is this? Well, it's a contagious disease that mostly happens with infants and young children. So what is it? Well, basically it's a contagious disease that is spread through mucus, saliva, and the feces of an affected person. So right off the bat you're thinking, okay, proper hygiene is going to definitely come into play here. You're correct. Considering this is a virus and not a bacteria, absolutely. What happens is it's got an incubation period of 3 to 7 days, and your child is going to start off with a fever. And that fever is going to cause this child to be irritable, may have diarrhea, sore throat, referred ear pain, just tired, and basically your child is just going to be sick. After that happens, a rash is going to appear, and it's about 1 to 2 days after. Your child will probably develop a sore throat with this as well, and because that's quite common. So what you're going to be looking for is a rash that can spread all the way down the trunk of the child, but mainly it's on the hands, the feet, and the face area. You can also find this rash inside the cheeks of the mouth, on the tongue, in the nasal passages, so just be aware of this. Now, this is a mild disease. There are no prescriptions available from your family doctor. They're not going to give you anything, and basically it's going to be done within a week. You will have to keep your child home during this time because they are contagious, and because it spreads through a sneeze, such as the mucus coming out, or a cough, that's where the saliva would come out, or obviously through the feces, so, improper washing of the hands. You need to definitely have your child stay home during this time. Once your child is better, when the rash is all gone, and it's not an itchy rash or anything like that, it's just one of those things that just happens. It's like a mild irritation, to be honest with you. And your child does feel sick the first few days when that fever is hitting, and then they're fine after that. So again, it's a very, very mild disease, and there's really no concern for this one. In more severe cases, and yes, obviously, with an autoimmune disorder, you're obviously going to go to your family doctor and get that checked out, and there will probably be something for them at that point, but that's going to be individual for everybody. With homeopathy, as long as a child is getting through this okay, there are definitely things that you can do. I mean, one thing I would do is on the rash, I would definitely, as long as it's not an open wound and everything seems to be okay, you can put calendula. It will help with the itching. It will also help with healing of the skin. The skin won't really have any side effects. They'll be fine. You're not even going to see any pock marks or anything like that. So the kids get through this pretty easy. And I mean, homeopathically, we've got remedies for fevers, remedies for, the hand, foot, and mouth disease, but it's going to be individualized. But it's something that, as I would look at, and watch this child, I probably wouldn't recommend too much other than, let's get the fever down just so that it's manageable, but it should be a low-grade fever. So honestly, children can get through this without any help. So once again, it's very, very mild. There's not much you can do other than proper hygiene. And just have your child stay home, which means that yes, you have to take time off work if you are working and unable to do that, then you're going to have to find alternative arrangements. But the idea is it's a mild disease. It's not a bacteria, it's a virus, so you will be fine with this. And that's basically all there is to hand, foot, and mouth disease. So if you like this information, please follow me on Twitter and like me on Facebook, and pass this along to anybody that you think would find helpful. I'm Shauna Bradshaw, Dr. Mom HD, saying goodbye for now. Looking forward to chatting with you later. Take care.